Hello, I am releasing this clip because there are controversial reports coming out, and people who have not gone into different parts of India and have not witnessed with their own eyes what has happened, they are giving a false report in the media, and some media is again bringing that out. This sort of sentences, what is said about India and India slum and things, which doubts or brings doubt in the minds of people who want to help the corona affected uh, victims or corona 19 victims. Why should we do that? Just listen to this for a while.
Record highs in the number of coronavirus infections.
India continues to battle a crippling second coronavirus wave.
Extraordinarily high COVID-19 caseloads and multiple variants circulating there. Crowded hospitals are turning away patients. Even if they manage a spot, oxygen supplies are often spent.
The ICU is so crowded, the doctors and nurses barely have room to move between beds. The only way to get into this unit is if a patient dies.
There are medicine and testing shortages, a thriving black market for supplies, and overwhelmed crematoria.
This crematorium believed it would probably process about 150 bodies today.
Crematoriums simply can't keep up, and bodies have begun washing up on the shores of India's holiest waters, the Ganges River.
Today, daily deaths topped 4,000 again. A lack of vaccine is fueling anger against the government and its leaders.
When you are in a very difficult situation, the way you are in India, you have to try and figure out ways to get as many vaccines into people as quickly as you can.
I have someone that has been on the ground in India for the past year joining me now. His name is William Tucker. William, hey, thanks for joining us. I really appreciate you coming on the High Wire here to talk about your experience. You spent the last year living in Delhi, and now you're the co-founder and president of Charity United. Tell us what that was like over this past year.
Okay, so I've been in India for the last 16 months, actually, over a year, right? So I arrived before the whole coronavirus scare hit. We originally went into the lockdown when everybody was uncertain, was this a real thing or not, right? And throughout the year, you read the news and you hear a lot about the coronavirus being so dangerous. But, I lived in the slums. I actually had a room in the slums because I work with children in the slums, okay? So I was in these places you see right now, I was with those children. I will tell you one thing. We don't know of a single corona death in the slums, right? I mean, we didn't hear about it. We hear about corona deaths on the news, but we have failed to see or witness any corona cases. I remember once the street was locked down because there was a reported corona case, but we did not hear of that person dying or anything, okay? Now, also what people don't understand, you call for a lockdown, a lockdown may work in the developed world. It may work in Beverly Hills, like social distancing may work in Beverly Hills. Well, it's worked there for the last 20 years, I think, right? But in a developing country, you cannot social distance. Okay, you're in the slum. Families live in a room of 100 square feet, and you've got 9 people in it. Okay.
So you're talking survival. So when the lockdowns were happening,
it's like these people can't survive anyways, right? Like corona is the least of their worries.
You understand this? This is how he reports. It may be true, it may be the least of the worries, but it does not mean that we should not impose social distancing. We should not educate our people to use uh, mask and even get into medicines, vaccines. This is a wrong thing because I, he might have been living in one slum for 1 year, maybe. I have worked in the great slum of Calcutta and back down in South 24 Barganas among the widows. I have worked in Mumbai slums. I have worked in Dharavi, Mumbai slums. I have gone and visited many thickly populated area. Why the COVID number of cases increased to that much first in Maharashtra? Because of that living close to each other. Then what happened? Our Chief Minister, Uddhav Thackeray, imposed certain things. Now the curve is coming down. Now, Tamil Nadu, why? Because social distancing was not practiced during the election rallies. Now the curve is going up. Now, what happened to the North India during the Kumbh Mela? The burning of bodies, all you saw, that's all happened in that Ganges River. Dead bodies floating around. So we cannot close our eyes like that. India is affected. India is affected very seriously, and we need to rush help. I have got documental evidences on what I need to share about um, the. Let us go into this part. Okay, now here you come. Now, what does it say here? India reports single-day record of COVID fatalities as death toll surges past 250,000. You know, among the near and dear ones of us, more than 5,000 are in the death toll, and we want to provide rehabilitation homes for them, restoring something. So this is the latest report, surges past 250,000. So the total number new cases as the official case loaded surged past 23 million. 23 million means 2.3 crore of people. 23 million. And in a day when ministry reports 348,000, as you see here, how much it grows per day, you know that. However, in the midst of all this, we do. So, beloved, understand this sort of a controversial report should not be put on media. We have to somehow fight for India and bring in whatever is needed for India and save the lives of the people. And let us not give any false information, give true information. God bless India.